Hello everyone, my name is Dr. Zaidi and I'm a GPST3. I have recently passed my SCA exam and today I will share the pattern that I followed in the exam. There is no hard and fast rule for the pattern, but I felt more in control of the consultation with this pattern and we don't lose the track. I will also give ideas to make the consultation patient-centered rather than doctor-centered. So SCA has three components data gathering, interpersonal skills, and management. To start with the data gathering, first comes introduction, Mr. Suppose, hello, Mr. Robert. My name is Dr. Zadi. Nice to meet you. How can I help you today? And after telling this, sometimes patient will open up and tell you the whole story. And sometimes patient say a single sentence like, doctor, I have a chest pain or I have a headache. If the patient says single sentence, you have to tell that, please tell me more about it. Remember, this is a very important point, like a golden minute, where patient tells you most of the story, and that will come up with the eyes or clue for the hidden agenda. The more patient will speak, more clues you will get. After introduction and letting the patient speak, now comes eyes. Now there are two possibilities for the eyes. Either patient has already given you eyes while telling you the whole story. For example, doctor, I have a fever, cough, and I think I have chest infection and I need antibiotic. In this case, you still want to show examiner that you have picked up the eyes by rephrasing the sentence. Like, instead of asking eyes again separately, like if you ask eyes again when the patient has already told you, then it will be the negative impact on the examiner that you did not listen to the patient. You can rephrase as, I understand you are concerned about chest infection and you want antibiotic, but is there anything else which is bothering you today or you want us to sort out today? The second possibility, if patient does not give eyes in the story, then you have to ask for it. For example, patient said, doctor, I have a cough for a few weeks, and he did not give you the ideas what he's thinking. Then you can ask in a way that, what do you think what's going on? And here you can understand about patient's idea. And then comes the concern. And you can ask that, anything particularly bothering you other than the cough? And the patient will say, doctor, I'm worried about lung cancer, I'm worried about COPD or asthma. Remember, here comes, you can ask, why you worried about the lung cancer? Why you worried about COPD? It's very, very important to explore the patient's understanding, especially about the concern. So this is a very important point. And then the expectations, you can ask that, anything particularly you are hoping from today's consultation? After eyes, I prefer to explore psychosocial impact on patient. For example, in a patient with a back pain, you can say that, I can see you are struggling with the back pain and it must be difficult for you. How are you coping with it? Here, patient will unfold the physical or psychological impact, and it will reflect you to be an empathetic doctor. Always remember to explore the impact on third party. For example, in a dementia patient's daughter, who is the main carer, is talking to you, then you have to ask, I understand you are worried about your dad. It must be difficult for you as well. How are you coping with it? Or do you have any support? No, you have to come to history taking. And before history taking, it's better to tell, I'm going to ask few questions. Sometimes it may seem irrelevant, but it's important to get the overall picture. For example, if patient comes with a diarrhea and you are suspecting inflammatory bowel disease, then you have to ask back pain, joint pain, and redness of eyes, which patient may feel irrelevant sometimes. So it's important to signpost the patient. Now, explore the symptoms, just 2 to 3 questions. For example, if headache is the main symptom, then explore briefly via Socrates. Very important, do not repeat the questions if patient has already told you in the initial story. Then few questions about differential diagnosis. Do not miss the red flags. I'm saying again here, do not miss the red flags.